Welcome to our webinar. This is Active Doctors Online, and the title of our webinar is Empowering a Healthier Workforce, Integrating Enterprise Solutions. I want to first introduce today's speakers. Today we have Dr. Howard Zahalsky, who's the U.S. Medical Director for Active Doctors Online. He is responsible for the corporate medical strategy and improving functionality and integration of the products and services Active Doctors offers. His responsibilities also include corporate medical quality policy and review. He's also plays an instrumental role in the Medical Records Assistance Program. And Dr. Zahalsky earned his medical degree from Brown University, completed his residency at Johns Hopkins, and he is a practicing doctor of internal medicine in the Washington, D.C. area. Bernard Lee
Hello, everybody.
Thank you, Dr. Zahalsky. Bernard Lee is our Executive Vice President at Active Doctors Online, and he oversees U.S. and Asia sales, account management, and marketing teams, as well as the North American business development efforts. He has over 20 years of broad management experience, including business strategy and marketing development. He's very involved in speaking with and hearing from day-to-day healthcare services and insurance segments, talking to corporations and hearing from both businesses and users of personal health records and second medical opinions. So he has a great perspective on what's important to companies as well as end users. Today, what you will learn in our webinar, we appreciate that you've taken a few minutes of your day to allow us to share the story of how to educate, enable, and empower your workforce to become more intelligent healthcare consumers. We will discuss today a little bit more about this concept of disruptive innovation, overcoming obstructive traditionalists. We'll tell you about what that means and why it's important. And in addition, the benefits to employees from the neck up and helping to reduce your organization's health-related expenses. I'm going to hand it off to Bernard Lee.
Well, good afternoon. I want to thank everyone for joining us today. This is the first of a series of seminars that we're going to be providing for employers and their employees to become more intelligent healthcare consumers, thus helping their employers save on their overall healthcare expenses. So first of all, who is Active Doctors Online? Well, it is our mission to change the face of the world's healthcare by providing people the control of their medical records and access to the world's best specialists, all connected by an online platform that we believe is designed for everyone. Our goal is to help people to save time, save money, and in extreme cases, we can even save their life through our solutions. Our story began in 2008 in France, where we were one of the first companies in the world to combine online PHRs, personal health records, and second medical opinions. And that second medical opinion that we provide in as fast as 48 hours, all done throughout our platform. This vision continued into the United States in 2009, where we expanded our specialist network to now over 1,500 doctors, and our product mix to include discount drug programs and also e-consultations. In last November 2011, we actually launched in Shanghai, providing our solutions for China's growing herbal middle class. And our specialists also participate in providing educational videos for Asian physicians. And in 2012, later this year, we should be fully operational. Now, you're going to hear this term, big medicine, and as you heard earlier, obstructive traditionalists. Big medicine really has a number of faces. One day, it may be a large insurance company that won't approve the cost of a specialist. The next day, it could be in the delay of your personal health records when you need them most. The questions to ask yourself is, how difficult is it to gain control of your medical records from your current physician? If you don't have the right health insurance, do you truly have access to the world's top specialist? And how long would it actually take to get that appointment? And you also have to consider what those related travel costs could be. Do you have access? Are you in control? Well, in our view, big medicine would be content with the status quo. And we truly don't believe that that's that mindset that ultimately benefits people like you and I. Unfortunately, this lack of access and control has resulted into something called the $700 billion elephant in the boardroom. Peter Orszag while serving as the director of the Congressional Budget Office, he stated that over $700 billion a year is wasted on tests and procedures that do not improve patient outcome. Now, when you look at it from, another perspective is $700 billion actually represents 5% of the United States annual GDP. So it's a big number. Could you imagine, quite simply, a loaf of bread that costs $54.80? Well, if you go back to 1950, the average loaf of bread was about 20 cents. And when you take a look at where we are today, most goods and services have increased 8 to 10 times since then. So a reasonable price for that same loaf would be $1.50 to $2. Well, if that same loaf of bread was produced and then sold through our healthcare system, the cost would be $54.80 because healthcare costs have increased 274 times since 1950. Employee Benefit News, in their recent article in their May 2012 issue, they stated that 23% of companies are now very confident that they'll continue to offer healthcare benefits for the next 10 years. That number is actually down from the same study that was produced in 2007 from 73%. So high cost, inefficiency, what's going on right now in terms of healthcare for folks like you and I, when our employers lose confidence, then that is going to be a large area of concern for all of us. The current status quo of big medicine, as I mentioned, you're going to hear the term big medicine a lot. It allows for a lack of consumer information. And that lack of consumer information leads to a 30% waste in healthcare spending annually. This also includes a $65.6 billion waste on duplicate lab and radiology tests. And this is something, again, that's occurring year after year after year after year. Active Doctors Online, what we understand is the value of providing more access and greater control of health information to the consumer. And we know that it results in a more intelligent healthcare consumer. And that benefits everyone because that ultimately allows the cost of healthcare to become lower. ADO Solutions, we're focused on patient care, education, advocacy, and our members now have a true healthcare partner, someone who's truly watching their back, protecting their interests. We become their advocate. And when you take a look at 25 years, well, it's been 25 years of research supports the evidence that the value of personal health records and second medical opinions are something that benefits the consumer. When you take a look at studies that were produced by Health and Human Services, the Markle Foundation, who has been providing reports and studies on personal health records for over 20 years, Robert Wood Johnson Foundation, just to name a few, they're all in agreement in terms of what the benefits are for personal health records. ADO Solutions, there are a number of things that we do. One, online personal health records. Again, I'll go a little deeper into it, but it includes medical records assistance. It's artificial intelligence based, it's interactive, it's interoperable. The encryption standards that we abide by are the highest that are available. It's AES, which is a military level of encryption. Everything that we do regarding our platform involves HIPAA. And it is, again, it's accessible 24/7. You own it, you control the PHR. Second medical opinions. We have over 1,500 specialists, and that is specialists worldwide who provide the second medical opinions for our physicians. We have a number of levels of physicians and specialists that are involved with Active Doctors, which includes U.S. and European medical directors, and then our state medical directors, as well as our specialists. We cover right now over 60 types of specialties, and one of the keys and one of the things that we separate ourselves from a lot of our competitors is our second medical opinions are completed within 48 hours time, as long as we have all of the necessary documents to provide for that opinion. And lastly, we've just introduced e-consultations, which as long as you have an existing relationship with a physician, you can have that physician provide a consultation via webcam or by phone, and it's all done, again, through our secure HIPAA compliant platform. Why PHR? You've heard me say, a PHR is about control. It is your entire medical history, all of your providers. You own it, you control it. Again, it is secure and encrypted. And as ours is, as I mentioned, you have military level encryption and you have bank level encryption. It is transparent, and there's an audit trail, which means that you know who's seen it and why, and if necessary, it can be tracked, and we can go into the specifics as to who's seen it. But it is really about you, the consumer, the employee, having control of your records and understanding what that control means. What it is not is an EMR, and you've probably heard the term electronic medical records. Electronic medical records are more geared to hospitals, insurance companies, and your physicians to communicate regarding our personal health records, our medical records. We may or may not be included in that communication. So the control which a PHR provides, an EMR does not. So a lot of the challenges that companies like ours have in this industry is to have people understand the differences between an EMR and a PHR, and really what that difference ultimately results in is control and access. The California Healthcare Foundation, and 2 years ago did a study on online PHRs versus those who utilize paper PHRs. The online PHRs showed a couple specific benefits that differed. One, fewer duplicate tests. It also allowed for an improved relationship between your providers. And when you took a look at that online PHR benefit, it also delved over into the relationships that you have as an employee, where absenteeism is a key number that employers all over the country are trying to reduce. Well, having their employers have access to a PHR and they utilize it and they understand the benefits of it and use it efficiently and effectively, it does help reduce absenteeism. Why an ADL PHR? Well, of course, we feel that there's so many reasons for anyone to utilize a PHR, but Active Doctors, where we separate ourselves from a lot of competitors, are, one, we are a global leader. We've been doing this worldwide since 2008. Our PHRs utilize all of the 7 traits of a perfect PHR, which are some of the things I mentioned earlier, and these are traits that were defined by the Marco Foundation. We're interactive, meaning that we can communicate with some of the EMR platforms that are out there. That's the integration in which we can communicate with EMR platforms. The interactive part is to where you're going to receive alerts from us. We have the ability to track certain numbers, as your cholesterol, maybe tracking your blood pressure, and to where once as long as you're filling out and utilizing the PHR effectively, you're going to receive alerts from us. Once you receive those alerts, it will help you, interact with not only the PHR, but interact with your own physician as to maybe you should schedule an appointment with your physician. Your blood pressure numbers are high, your cholesterol numbers are high. We have a history of success, as I mentioned. We right now have over 130,000 members and 1,500 specialists who all believe that people deserve to have more control and access when it comes to their medical information. And at the end of the day, it all results into a reduced healthcare expense. All of our memberships have something that's called medical records assistance, in which through a HIPAA release, we contact your provider. We always suggest your primary care physician gather the records and upload them into the platform for you. So that is all included. A lot of times people believe that they have something similar through an EMR. It may be something that is through their current insurance company. Generally, in most cases, that EMR may show just a CPT code. So it'll show maybe what the cost was of that hospital visit. Ours incorporates a lot more to where actual doctor's notes may be whatever is in that file. Our team is going to make certain that it gets uploaded into your personal health record platform. Also, medical records maintenance, 4 times a year. You contact us, and our team will contact your physician to, again, through a HIPAA release form, gather those additional records for you and upload them to the system. You may have heard the term disruptive innovation, and we spoke about it briefly earlier. If you think back, a little over 10 years ago, where no one believed that we would be banking online. Well, now it's something that's normal, but the obstructive traditionalists, they said, well, there's a lot of uncertainty there. Who knows who will have the opportunity to view your records? Is it secure enough? Is there a fear in terms of you possibly losing your money? And we know that that's no longer the case. The result was an improved solution when it took a look at the banking segment in general. The online banking advantages, it ended up ultimately being more convenient for us. It empowered consumers to make better choices. The products in banking became more personalized, and ultimately you had more educated consumers. The banking community, now they became more active in terms of their internet strategies because banking became a lot more competitive. Their technology continued to advance, and then their regulation increased. So it all resulted into a better sector in which we use, daily, banking. And a lot of folks believe that that's exactly where online personal health records and second medical opinions are headed for, an improved solution for healthcare providers. Now I'm going to have Dr. Zahalsky take over from here for a while. Doctor?
Hello. So again, I'm Dr. Howard Zahalsky. I'm the U.S. Medical Director for Active Doctors Online. And I wanted to talk to you for a minute about our second medical opinion option through our online PHR, where we have our second medical opinion specialist actually review one of your medical conditions or questions and provide an answer for you. First, I want to put this in perspective, why this is so important. Up to 40% of initial diagnoses have been found to be incorrect, and 200,000 Americans each year die from clinical mistakes. That makes clinical mistakes one of the top 10 leading killers of Americans today. In particular, prostate cancer, one of the most common kinds of cancer. Up to 20% of grading and staging evaluations initially have been found to be wrong when rechecked by subsequent specialists. So why do we need an Active Doctors Online second medical opinion? Because we are your backup specialists. We are your specialists who can come in not after the fact, not years down the line, but when you need us for a second medical opinion. Some of the advantages of our second medical opinion system: number one, obviously we're secure and encrypted. We have a very high level of security, as Bernard was going through with you. Military level security. Your records and your second medical opinion will be safe with us. We have a tremendously fast turnaround time. We like to complete our second medical opinions within 48 hours of having your up-to-date records loaded into our system. Next, we are your advocate. Further down the list, you can see unbiased. Our second medical opinion specialists have nobody's interest but yours. We're not looking to do your surgery. We're not looking to make money off you by recommending a procedure that you don't need or medication that you don't need. We're strictly on your side. We have a global perspective. As Bernard mentioned, we have 1,500 specialists. These are some of the top specialists from around the United States, trained at some of the best United States facilities and hospitals, but also some of the best specialists from around the world. You also have live interaction, and in a couple of minutes I'm going to go through the whole second medical opinion process with you. But you will have direct interaction with our medical directors and even with our specialists to make sure that you are getting the answers that you need. And the result is that it all comes for just pennies a day. You can have some second medical opinions included with some of the packages that we offer for our personal health record. So let me talk to you about our specialists for a minute. Again, we have some of the top specialists in our field. We're talking board certified, experienced specialists. We're not talking people who are in the lab and just researching. We're talking doctors who are still practicing on a day-to-day basis. All of our specialists are credentialed. All of our specialists are reviewed by myself or one of our other U.S. medical directors. They all have background checks, and they have all been trained at some of the top hospitals and medical schools around the country and around the world. This picture that you see on your screen right now is Dr. Yasin. He's one of our top ophthalmology specialists. I just want to focus on the highlighted area here where it says, Active Doctors Online has applied the best information technology and a vision towards the future to a fragmented system for a truly unique and valuable approach to getting a second medical opinion. I just want to echo Dr. Yassin's words. Sometimes our second medical opinion can be just the thing you need when you're faced with conflicting medical information, confusing medical information, and when you're not sure where to turn. Now let me go through the second medical opinion process, how it works directly for you and your employees. The patient, at the time, will request a second medical opinion through our online PHR. They will then be put into contact with one of our U.S. medical directors. The U.S. medical director, once they determine the state of the patient, because this is relevant to make sure we are following all of the necessary healthcare laws throughout the country, will then assign one of our state medical directors the case. The state medical director then takes the case in question, reviews all of the medical information in the patient's personal health record, confers with the patient to make sure all of that is up to date. As you can see from the arrows, this is always a two-way process. There is always going to be feedback both from the patient to the medical director and from the medical director back to the patient so that the patient doesn't feel lost in the process. Once we make sure that all of that information is up to date, the case is distributed to not one but two experts in the field of the issue in question. Those specialists then report back to the medical director, who tries to put the report, if it is not already, into a concise, readable report that does not use language that the patient will not be able to understand, returns the report to the patient, and then will answer any questions from the patient that comes out of the report. If there are any further or follow-up questions, the medical director can go back to the specialist and ask some follow-up questions. We treat this as a committee approach, where there's a whole group of people working to get you not just an answer, but the right answer. So I want to go through a case study, one of the second medical opinions that we actually did for a couple of minutes. In this case, we had a client who was diagnosed with invasive prostate cancer and was considering several courses of treatment. We sent two specialists to review the case, and this included a urologist, Dr. Michael Preston, who completed his medical training at Brown University and did a urology fellowship at Mount Sinai Hospital in New York, as well as Dr. Alan Hertig, a professor of urology and head of the urology department at the leading hospital in Paris, France. We completed the second opinion within 48 hours of the client uploading his pathology records into our system. The client was already tentatively scheduled for surgery the next week, and he found the speed of our input very valuable. We were able to review his chart and get back to him within 48 hours, and we provided several useful recommendations. First, the specialist confirmed that he did in fact need surgery for his condition. The client was considering canceling the surgery in order to pursue non-invasive treatments. For his type of prostate surgery, our consultants confirmed that the less invasive treatments would have been a mistake. Second, Dr. Preston suggested ways to actually improve the surgery, and our client surgeon took Dr. Preston's recommendation, which have been shown in studies to minimize the risk of the client's cancer from recurring. The clinical impact of our consult is obvious. By using Active Doctors' online second opinion, our client may have improved his chance of surviving prostate cancer. We use the top specialists from around the country and around the world. And as in this case, we were able to present information that a local physician may not have been aware of. But there may have been a financial impact as well. Because we were able to get our consult done so quickly, we were able to have the client's surgeon adjust his initial surgery. This may, in the long term, minimize future testing, repeat surgeries, and, God forbid, recurrence of his cancer. This keeps our client working and minimizes the cost for his company and his insurance company. Even if he had wanted to see another physician for a second opinion, it's very unlikely he would have been able to get in to see a top specialist in the time available if not for our service. We were very proud of the service that we were able to provide to this client. So this slide shows the global influence that Active Doctors is having. As mentioned in the case study for our client second opinion, we have an international gathering of specialists to help provide answers when our clients need them. Dr. Francois Durand, who is head of hematology and liver and intensive care in France, said, "Our objective is to offer access to a secured network of high-ranking specialists in partnership with Active Doctors Online. Such a network gives rapid access to patients for a second opinion based on a thorough review of personal medical data. We are an international company, and we are a groundbreaking company, and we're trying not just to provide the same old thing in a new way, but to actually provide innovative new ways to approach medicine and medical care."
Thank you, Doctor. As Dr. Zahalsky mentioned, the goal of Active Doctors Online is, obviously to be that advocate and ally for consumers worldwide, but also to have people to understand that, we are more than medical records, and that we are a company that has global influence. And, we believe that that global influence is what, helps to assist people take better care of themselves. We'd like to talk a little bit about, again, back to today, ADO memberships, why they are a valuable employee benefit. First of all, it provides employee tax benefits. It is active personal health record memberships is a benefit that an employer can make available under Section 125 cafeteria plans, and which the employee can actually elect to pay for on a pre-tax basis, assuming that the other applicable Section 125 requirements are satisfied. So to bring that in real words, one, if you have an FSA, an HRA, or an HSA plan, the memberships do qualify under those types of employee benefit plans. How employees benefit from Active Doctors Online. Ultimately, through the utilization of our memberships, studies show that they are more engaged and motivated. Obviously, we believe that their health outcomes improve. They begin to make use not only just Active Doctors Online resources, but also some of the other resources that the employer may also provide. It is really about that interactivity and making sure that their workforce is engaged, and Active Doctors Online also assists with that engagement. Some other quick employee benefits: improved communication with the healthcare providers. Again, the global view of medicine, as we mentioned earlier, that we have a presence obviously in Europe, in China, and the United States, and that is going to continue to expand worldwide. We are the employees and the individuals' healthcare advocate and ally, and more importantly, in a lot of cases, there's really no need to wait for an open enrollment. Worst case scenario, that our plans are available as a voluntary employee benefit as well. So there's really not a need. If there is a need, and we believe that there is, for employers to bring on a benefit that allows them to help reduce their healthcare expenses, then we believe that this is a solution for their employees. Let's talk a little bit about workplace wellness and PHR, a winning combination. And according to the Wellness Council of America, also known as WellCOA, that 95% of any wellness plan, that a PHR is responsible for that number. So this actually comes from Dr. David Honeycutt, who is the president of WellCOA. So just to be clear, he said that 95% of an employer's wellness plan, their health and wellness plan, should rely on the personal health record. The information that's in your PHR is going to be beneficial, whether it comes into health risk assessments or biometric screenings. A PHR is going to assist with all those vital numbers in which an employer is looking to monitor an employee's progress. It also obviously curbs healthcare costs. We've spoken about that so often now in terms of the benefits of a PHR, and it's really about engagement. Having your workforce be much more involved in their wellness. The employer obviously has a reason. He needs assistance in helping to educate his workforce, and when he does it properly, and we believe through a PHR and through health and wellness, that it is going to result in lower overall healthcare expenses. A little bit, just again, pennies a day. We'll get into the specifics, but our solutions help lower health-related employee costs without sacrificing quality care. And according to a recent Harvard School of Public Health study, they measured that medical costs fall by about $3.27 for every dollar spent on wellness programs. And absenteeism costs fall $2.73 for every dollar spent. The result of this study's financial impact analysis was a decrease in modifiable risks, showing that a potential projected cost savings through widespread use of the PHR. So, for us, this is something that is an obvious fit for employers. It's money well spent. Don't just take our word for it. There's 20, 25 years of studies that also support the value of an investment by an employer, obviously into a health and wellness program, but into incorporating personal health records into that. And we take a look at the ROI just briefly. PHR utilization, just taking a look at the numbers here, and the PHR utilization 3 times per month showed through a study that was done by WebMD, actually a 2-year study, and they showed a group of over 1,500 online PHR users versus a control group of non-PHR users, what the benefits were. And just a couple of the numbers, it showed that the PHR users had a greater readiness to change behavior by 7.5% over non-PHR users. They also were better prevention screening compliant, 8% versus non-PR users. A decrease in depression and stress, almost 3 to 1. And the absenteeism decreased by 10% in PHR users versus non. And when you take a look at what we also provide every time that we're speaking and presenting to employers, that on that ROI, we do a cost-benefit analysis, and the cost-benefit analysis is really based on the employer's current size of the workforce, how much they're truly spending right now on healthcare, and consistently, we can show employers a healthcare cost reduction of up to 10% per year through the utilization of the PHR on an average of 3 times per month, and of course through the utilization of a second medical opinion at 1 time per year. Types of memberships that we offer: PHR individual plan, PHR family plan, and then the PHR individual plan plus and family plan plus. Now, all of our plans include medical records assistance, and the plus plans include 1 second medical opinion per year. That is for an individual or for a family. The family plans, they include up to 5 personal health records and 2 medical records assistance. So we believe that we, again, go back into the types of plans and the simplicity of the plan, but the benefit to the individual and to their family, we believe, is enormous. And we don't just say, well, here you go. You become a member and just go online and learn everything that you can about personal health records and second medical opinions. We have an ongoing integration that includes webinars like this one, live seminars. You're going to constantly receive the e-newsletters, which come monthly. We also work with the employer to co-brand a lot of the pieces that are necessary to communicate to their employee. There are monthly and quarterly utilization reports showing the metrics and the utilization. And then the employees and employers also have the ability to make use of the white papers that we produce here. And just a sample of some of the marketing pieces, from the newsletters to some of the on-site posters to 5x7 cards that are placed throughout the employers' lunch locations, and also some of the mailings that go out. And finally, we just want to talk a little bit about a case study. Fouquet's Barriere is a company in Europe. They currently have about 12,000 employees, and they initially came to us with a huge issue. It was their high presenteeism and absenteeism, which they obviously wanted to reduce. So the program, actually, a relationship began with them in 2008 with only about 300 employees, and it started as a pilot program. Now our advantage is through educating their employees, and with the assistance of our network of specialists and user-friendly tools, we were able to communicate a lot of those integration and marketing pieces that we showed you earlier. The first step actually resulted in a greater acceptance of the importance of utilizing a PHR platform for their employees. What we found, though, is that on an average of employees utilizing the platform 3 times per month, and we were able to take a look at that number through the metrics that were performed monthly as to what parts of the platform they utilize more. Did they become involved with the webinars? Did they participate in some of the online, the seminars also took place? And what we also found is that the second medical opinions is something that the employees utilized in a rate higher than those who do not utilize second medical opinions. So what it ultimately resulted in was their employees becoming much more engaged and involved in their health and wellness programs over there. So for 12,000 employees, we started at 300, and now we have the entire Phuket Barrier workforce, which is all throughout Europe. And a lot of times people always wonder, well, what does all this information mean? And we like to just show it to you very simply and to introduce you to an employee that looks a lot like the employees that work for you now, and his name is Sam. Sam works for Superco, and here's a quick view of Sam's coworkers. And Sam has an employer-sponsored health and wellness platform. He has health insurance. So one day while Sam was running, he sprains his knee. And since he has great health care benefits, he visited his physician, who suggests that he go and have an MRI done. Well, Superco self-insures, so they foot the bill. 3 months later, Sam still has that bad knee. But instead of going to the first doctor, who he's actually not that happy with, he decides to see doctor number 2, who suggests another MRI. And Superco foots the bill again. Problem with this scenario: if Superco keeps footing the bill for duplicate tests for Sam and his coworkers, Superco will no longer just a new and improved be super. Why Active Doctors Online? Because we educate, empower, and protect our employees while helping to keep Superco super. For more information and to schedule a demo, please feel free to contact Dr. Zahalsky. Here's his email, Dr. Zahalsky at Active Doctors Online. Please feel free to contact me, blee at Active Doctors Online. And you can also contact us on our toll-free number, 888-51-ACTIVE. And we obviously have a huge presence on social media. You join us on Twitter, LinkedIn, Facebook, and we also have a blog that supports a lot of what we discuss, and it gives you a sense of what's going on in the industry and also going on with Active Doctors Online and their specialists. Again, for Dr. Zahalsky, my name is Bernard Lee, and thank you again for joining us, and look forward to our next seminar about a month from now.